DeviceNation behind the booth here in San Diego, Academy 2025, with two really impressive people, Anton Clifford and Dr. John Lane, local surgeon.
Yes.
Where's the sunshine?
We forgot it.
We forgot it. I've been following the Spring implant for quite some time, and things have changed. MISHA, here we are. Whoever wants to talk first, tell us about how it got started and where we are today.
Start with where we are today, right? Got a market clearance in 2023, launching the product, building out the company, getting a lot of excitement on the floor, but generally about the option of now having a treatment for patients that are not ready for arthroplasty, but they're in real pain, especially activity-based pain, daily jobs, sports activities that they're just limited by, and now the patients have a solution for it. It started in 2008 when we did our first patient on a different platform of technology called Spring.
Correct.
And those first studies were done in Australia. But we knew from those very first studies that the device worked. There was evolution to do with the technique and the implant and continue to improve it. But even those very first patients did tremendously well with the technology, and that's what kept us going through lots of iteration of the technology to where it is today.
We've got the latest iteration right here. If you would, just walk us through what you changed from the original Spring to the current iteration.
Yeah, the principles are the same. So we wanted to stay outside the joint, preserve the joint and all of its ligaments, no bone cutting, keep all the options on the table for patients if they elect to try MISHA, or at that time it was Spring, and it didn't work out for any reason, they could still go on to all of their other options. So that never changed. What did change is we reduced the size of the implant. We moved from a metallic metal-on-metal implant to now a polymer on metal platform. And before there was a helical coil spring, and now we have a polymeric absorber technology. So again, that was through a lot of iteration over years and 8 different clinical studies over time.
I'm from Alabama. We love a lift kit on our trucks. I love a lift and a level in your knee. So how much distraction or how much are we pulling back out there?
So the device doesn't distract. We don't separate. What we do is we absorb. So we take forces off the surface. So typically with a patient, and Dr. Lane can speak to this, the joint is overloaded. Right. And that's what causes the pain. So what we do is we take down the overload.
Awesome.
So it's like an implantable, it's like a knee brace, right? Or an osteotomy tries to do the same thing, but that cuts bone and shifts load. We absorb load from the joint surface. So we don't jack it open, we're not a distractor, we're an absorber.
Part of me is disappointed in that. that's my Alabama boy coming through. Anything you'd like to throw in here, Doctor? What do you think?
Yeah, I think it's really important in that group of people that you want to do joint preservation. Because really, as we have more and more people sustaining injuries in their teenage years, and obviously for a long time they won't be appropriate for joint replacement or anything else, we're doing meniscal transplants, osteochondral allografts, or we're growing cells and implanting them. So we're really changing the whole milieu of the knee. And so we have this group that they're on the middle-aged side that really don't need a joint replacement, but we're still in that joint preservation concept. And they're a little beyond what we can do with some of the other techniques I mentioned. So this is such a huge win for the patient. You don't have the osteotomy complications, the downside. One of my patients that I had was running within 2 months, and you're immediately putting weight on and progressing very quickly. So your downtime from not being able to work or participate in sports is dramatically decreased. And it's maybe a good intermediate step, and we don't know how long it's going to last. So it may give you, quite a few years of good pain relief.
What's the recovery protocol? I walk into your OR, I get one of these put in. Am I just off to the races the next day, or do I need to sit tight for a little while?
Well, we have them be partial weight bearing immediately. We want to allow the time for the incision to heal, and then we start progressing them as their pain tolerates.
Okay. Cool stuff. This is a cool implant. It's different, and it's an option that really ticks off a lot of boxes for, like you said, that patient that's just not in a good slot, right?
No.
Right. So for watchers, listeners that want to learn more about Moximed, where MISHA's at now, where it's going, how do they learn more?
Well, our website, first protocol, so www.moximed.com, and then lots of information online about the MISHA Knee System and how patient testimonials and testimonials from surgeons that are actively using the product.
Really cool product, moximed.com. Check them out. Wish you guys a very successful academy.
Thank you so much.
Thanks very much.
Thank you.